Hi, everyone. I'm Dr. Faisel Sayed,
And I'm Dr. Dan McCarter.
and you're listening to Faisel and Friends, where we believe access to primary care is a right, not a privilege. Today, Dr. Dan and I are talking about unscheduled patients. Problem or privilege? Let's dive right in. Hey, Dr. Dan.
Hey, Faisal. How are you?
I'm doing really well. I had a great day in clinic yesterday, and we had a couple your usual, couple unscheduled visits, and the rewarding feeling after those experiences kind of got me thinking, saying, hey, that'd be a great conversation. It's such a paradoxical situation in outpatient medicine America today, where an unscheduled patient is viewed as a burden on the schedule.
Yeah, you brought that up earlier. I was talking to my wife. She has a family member. I think it's like a second cousin. It would have been like her mom's first cousin. So, this is a man in his 80s, and he's had a fever of 102, and his primary care
Oh.
doctor is saying they won't see him. You can take him to the emergency room if you want. And they had gotten a home COVID test, and his test was negative. And I was just, you know, how, we're talking about the improvement of primary care, but how do we, you know, when did it become, as healthcare providers, as primary care physicians, that the person in need is a problem instead of granting us the privilege to be a part of their life? I mean, riddle me that, Batman.
Well, this is what happens when you have a hospital based healthcare delivery system. See, if we had the reverse, if we had like a quality primary care based healthcare delivery system, of course, a patient showing up unscheduled, that's our opportunity. I mean, it validates the trust that they have with not only the doctor, but the entire primary care delivery team that, hey, I trust this person. I trust this team of people over the urgent care down the street, over the emergency room, to help address whatever the situation is that they have going on in their lives. And for us in healthcare, I think about what makes us feel fulfilled. When did it happen that the expectation from patients when they go see their physicians is to have a medication added? Like, oh, going to go to the doctor, I'm gonna probably going to add another medicine or increase another dose of medicine. What how can we bring it back to, well, actually, what can we do to reduce some of your medicines? And having that culture, and it's going to take a shift. It can't continue on the way that it is. It's just, not only is it not sustainable, but it's not fulfilling. I think that's one of the main drivers to burnout that we're seeing right now.
Right. Right. And I don't know if we've talked about it here on the podcast. You and I got the privilege to meet Ali Parsa, the CEO of Babylon Health, and he's talking to a room full of physicians, and he said, "I don't know why everybody's talking about burnout. You're in one of the most successful industries in the history of the world. Your industry is consuming one out of $5 of the largest economy in the world." And he said, "But wait, the doctors are in a business they didn't choose to be in.
Yeah.
So, how do you create time to help people in need rather than just having the schedule, put together? Um, I think we've talked about it. A lot of times people think primary care is about refilling maintenance medications. I mean, again, another thing from my personal life. I mean, my wife had a couple of her maintenance medications that she needed refilled. She had just seen the doctor 6 months ago, and the standard reply from the office is, "Well, you've got to come in to be seen to get the prescription refilled." And she's like, "Yeah, I've been on these medications for 5 years. Nothing's changed. Why do I need that?" So, I mean, we have the privilege that a lot of people don't. I was able to text her doctor and he took care of it. It was not a problem. But most people don't have the ability to get through to the provider that way. But we take up so much time trying to insist people get the less necessary care that we don't have time to take care of the people who need it the most.
We're too focused. We're too focused on the schedules and generating business from each of the interactions, and rather than being focused on really just making a difference and making an impact. And yesterday I had a one of the situations, the unscheduled patient who just showed up at the center. Nice guy, friendly guy, and he was struggling with seeing out of his right eye, and he used a power washer for the first time the night before. Didn't wear the protective goggles, and everything was going fine until he hit something that like created a bunch of debris in his face, and he was able to get most of the debris out of the one eye. Actually, got it all out all on the one eye, but there was still a little bit left in the other eye. And he said, "I could feel it's moving around up in there." And I looked and I said, "Oh, can you see?" And I'm looking at his eyes. He's looking at my finger. He told me I could see, but it's hard. It's very painful. And I just took him to the sink and I rinsed his eyes out, And within seconds, he just immediately hugged me. He's so appreciative. He said, "Ah, feels so much better." The relief that he felt. And in that moment, I remembered, I thought, boy, was there really any doctoring that was involved there? I mean, there was some doctoring, of course, that was involved, but the amount of just how fulfilling it felt, like, this is why I became a doctor, to help people in these situations. It was not a medically complex situation, but for the patient, it was a big deal, and we were able to address it. That gave an incredible amount of fulfillment to me. At the same time, there was another patient I had with congestive heart failure, and someone else who had an itchy throat and was worried that she had an allergic reaction. So I mean, it was your typical, you know, typical day at the clinic, right? But the appreciation, being able to help him, the appreciation from him, and then of course, I couldn't let it go. I noticed he hadn't been to our center for since February, so I had to rub it in that, hey, so you only come to us when you need us. Can't you come in and for the regular checkups as well? And he said, "Oh, I'll come. I'll come."
But you bring up a good point, is having the time. I mean, Michael Balint in his book, the doctor, no, the patient, the illness, and the doctor, his patient, and the illness. I'm sorry, I'm butchering the title of the book, but he talks about the doctor prescribing the doctor as treatment. I mean, that relationship has therapeutic effect. I mean, the patient that you washed his eyes out that wasn't coming in for visits. I mean, now he's had a dose of doctor, and he's seen some improvement from doctor. I mean, the problem with a lot of the doctoring we're doing, we're trying to convince people to take drugs for their cholesterol or their blood pressure or their diabetes. And if anything, they feel worse, not better, when they're taking the medicine. So how do we convince them to do that? I mean, you say often, if we don't take care of the small things, why will anybody trust us with the big things?
Exactly.
Right?
Exactly. That's how you build trust. Could you imagine if we had a culture where every unscheduled visit with a patient was viewed as an opportunity to build trust in restoring the sacred doctor patient relationship? Imagine what that would do. I mean, especially in this time of incredible burnout. Many doctors will reach out and they say, "Well, I'm so burnt out. This is not what I signed up for." And but it's actually the things that show up unscheduled, like the situations that arise, that the patients have, that show up in a completely, it shows up because life's emergencies never happen on a schedule. And being able to help that patient reminds everyone, either directly or passively, this is why I'm doing what I'm doing. This is why I go through all those hard moments.